चलिए फिर मैं शुरू thank you so much. Good afternoon, everyone. I am Arun Verma from Team Sipher. A very warm welcome to all the participants to today's webinar on good and applicable and innovative practices in tobacco control in India. Today's topic is involving school teachers in the tobacco control, which is based on a very interesting story from the Bihar state, India. The study being personally conducted with the help of the other team participants by Dr. PC Gupta under his personal supervision. So today's speaker is author of this story, Dr. PC Gupta, who is a most respectable, gracious, and eminent person in the field of tobacco control. So on behalf of the organizers, which is a Sipher, Resource Center for Tobacco Control and ECO India, I express our gratitude and extend a very warm welcome to Dr. PC Gupta, and we are extremely grateful to him for sparing time for this webinar. And we all know the kind of knowledge and the way he presents his knowledge or shares his knowledge with his participants is excellent, and it's really which anybody can consume and digest very easily. I also extend a warm welcome to Dr. Rakesh Gupta, who is the President Sipher, Mr. Rajiv Chaudhary, the Program Coordinator from Department of Community Medicine, School of Public Health, and of course the Resource Center for Tobacco Control, PJM, Chandigarh. I also welcome from the participants from the ECO India, Dr. Sanchika Gupta, who is a project manager with the ECO India. I extremely welcome all the esteemed participants and the public health students. With this, I would request Dr. Rakesh Gupta to please introduce the speaker of the day, Dr. PC Gupta.
So thank you, Arunji. So as everybody knows, I think, because many might have attended the last webinar also. So Dr. PC Gupta, he is director of Healis Sekhsaria Institute of Public Health, Navi, Mumbai. And he is amongst the top 2% of scientists worldwide published in September 22 in PloS Biology. Dr. Gupta's name appears twice, once as Prakash C. Gupta and with affiliation as Healis Sekhsaria Institute of Public Health in the field of public health, and once more as PC Gupta with affiliation as Tata Institute of Fundamental Research in the field of dentistry. Dr. Gupta was in TIFR until 2004. Healis was founded in 2004 and he has been directing it since then. There are 11 names from India in public health and 3 in dentistry, with Dr. Gupta topping both the Indian list. So you're welcome, sir.
Thank you.
Yeah, are you able to see?
Yeah, I can see. No problem.
Oh, okay,
yeah. Okay. Thank you very much, Rakesh, for the generous introduction, and thank you very much, Vermaji, Arunji, for your introductory remarks. As already stated, this is a kind of a story. It's a case study involving school teachers in tobacco control. And this case study, this is a research story that I will share spanning more than 20 years in the state of Bihar. So next slide, please. Now, why did we select school teachers for our work? Several reasons. First of all, school teachers are role models for students and the community, especially in India and even more especially in rural India, because quite often in a village, a school teacher might be one of the very few persons who is educated, literate and educated. Now, the focus on tobacco became because tobacco use prevalence among Bihar school teachers was found to be very high. And we thought that the knowledge of tobacco use cessation and tobacco-free educational institute among them would advance tobacco control. Next slide, please. And how did we find out? This is almost like a quarter century study. because we started a global school personal survey along with global youth tobacco survey in collaboration with CDC USA and WHO, World Health Organization. So in the global school personal surveys were carried out state-wise in India, all over India during the year 2000 to 2003. And the methodology was that a self-administered anonymous survey was conducted in a random sample of generally 50 schools, 25 schools in small states. And among school teachers in Bihar, where we conducted the survey in 50 schools, prevalence was found to be very high. Current use of any kind of tobacco was 77.8% in Bihar versus much lower in all other states of India. For example, 30% in Maharashtra. The prevalence was higher than in most states, and this is a published result, as you will see the Tobacco Control 2002. Next slide. Now, we all know that education is a state subject in India, and almost all schools are under the state government. So the survey was conducted under state government schools. But there is also another school system, a smaller one, that is run by the central government. It's basically for the children of their own employees that can be transferred from state to state. Now, we also conducted a sample survey of 50 central government schools in Bihar at the same time, 2001, exactly same methods. Next one, please. And the results were quite different. Tobacco use prevalence among central government school teachers was found to be much less than the government school teachers, than state government school teachers. Daily smoking, for example, was 2.4% in central government versus 14.5%. Daily smokeless tobacco use 14% versus 41%. Occasional smoking 7% versus 22%. Occasional smokeless tobacco use 12% versus about 16%. So clearly there was a difference. So what could be the reason for such a huge difference? So the major difference was the existence, awareness, and implementation of tobacco control policy in the central government school. For example, 0.1% versus 67% said that there was a ban on tobacco use in school premises for teachers. So there was not only imposition of tobacco control, but also implementation and knowledge among school teachers. So we thought that the Bihar government school teachers should be helped for their tobacco problem through tobacco use cessation and by implementing tobacco-free school policy. Next slide, please. So we planned a randomized control trial with the collaboration and support of the Education Department of Bihar. We selected 10 districts in Bihar and randomly selected 72 schools out of those 10 districts. Those are middle schools. And this was done during 2009-11. We did the evaluation by pre and post intervention surveys. Observation checklist was made on the compliance with tobacco school policy. So next slide, please. So we had 36 schools in control arm, 36 in the intervention arm. And before planning our intervention, before deciding on intervention material and strategy, we conducted extensive formative research among Bihar school teachers. And here you can see our collaborator from Harvard, Dr. Glorian Sorensen, and others, Dr. Sinha also you can see from Bihar. So we planned this RCT after a lot of formative research. So we decided on the intervention program that consisted of 6 themes to be delivered to teachers during a single school year. That's very important because we wanted to deliver the entire intervention in one school year, because from one school year to another, there can be a lot of changes. Now, 6 themes with 1 poster for each were teachers as role model, the first theme. Second, health effects of tobacco. Third, motivation to quit or help others quit. Because some, of course, not all teachers are tobacco users, so many are non-users. So for them, the motivation is to help others quit their tobacco use. Then the skills that are required for quitting, dealing with withdrawal symptoms. We all know it's an addictive substance, and when you try to leave it, there are withdrawal symptoms. And then if final thing, after one succeeds, there is some kind of maintenance and celebration. And the program also included guidelines for making school tobacco free. Next slide, please. So the training, what we did for training, we invited either the headmasters or the lead teachers. Headmaster nominated a lead teacher and they were invited for training. And the training was on encouraging and helping tobacco users to quit their tobacco use, schools to implement tobacco control policy, organizing group discussion among school teachers on tobacco control, and providing reminders by displaying posters. So that was the basic material and agenda of the training. And then after this training, specific material was provided to headmasters and to lead teachers. A set of 6 posters, 1 poster for each theme, copies of a quick booklet that helps in how to quit tobacco use, providing various strategies for quitting tobacco use, and write up for tobacco-free school policy. Very important, how you make a school tobacco-free. Now, core components to be implemented by headmasters and lead teachers were conducting at least 1 discussion per month with teachers on tobacco control, cessation of tobacco, and on the material and the training that was given to lead teachers or headmasters. Display of a no tobacco school policies. No tobacco in the school, that policy should be displayed in the school, and monthly display of posters. Each poster was theme was for 1 month. Next slide, please. Now, these are the posters I'm showing. So these are the first 2 posters. The first poster is, teachers as role models. So the teacher is telling that I am a teacher, I do not use tobacco, and therefore be like me, a role model like me. Then the second was health effects. And the poster for this health effect, I think many would have seen, is a very famous poster used by WHO also, and we adopted from that, which in 1 poster shows a huge spectrum of health effects that are caused by tobacco. And you see that since it was in collaboration with Harvard School of Public Health and Healis and Department of Education of Bihar government, all 3 logos are there in each posters. Next one, please. Now, motivation to quit. So what is if a person is user, or even if a person wants to motivate others to quit, the motivation most important is family. The members in the family, especially children, they are really troubled. They are hit by the tobacco use of their father or whosoever is the main family member. The women and children don't like that, and that becomes a motivation from the family for quitting tobacco use. That's one of the major there can be other motivations, but that was the most major motivation we found. So we used that for that poster. Then the skills to quit. It's not easy to quit. So what the skills we zeroed on pride on quitting tobacco. There is no kind of shame that person has quit the tobacco or this, but there should be a pride asking for help from friends, and always saying no in case somebody offers, also saying no to tobacco. Next one, please. So now, dealing with withdrawal. Now, withdrawals are very important, and there is, because of withdrawals, we know that there are a lot of relapses also. Even after one quits tobacco, there can be a withdrawal. Please, slightly. So now, withdrawal symptoms, we have given this kind of advice. We selected this kind of advice after talking with them. One is exercise, physical exercise, and yoga exercise. Those are very helpful. Then walking. When there is a craving, one can go for a walking. One can drink water immediately. or you can eat something. If there is a craving for eating, one can eat something, and that is something that is there already in the kitchen, like some fennel seeds or cloves or cardamom or some such thing. One can also wash the face with cold water. That also helps in relieving these withdrawal symptoms. So after dealing with all that, when a person is successful, there is a celebration, and that celebration and success is shown in this poster as tobacco-free family, and where everybody is happy. So next one, please. Now, so what happened? Now, we had 36 schools in the intervention group, 36 in the control group, and we had conducted this in 18 schools over 2 academic years. So we had done a baseline survey before the intervention in both groups, and a post-intervention survey in both intervention and control group. And number of teachers were almost similar, 387, 369. And prevalence in the baseline survey, again, quite similar, 33% in intervention, 37.9% in control. But immediate post-intervention survey, the 30-day abstinence was the criteria, and adjusted quit rate, which I adjusted for confounding factors, random school effects and all that, was 50% in the intervention group, control 15% in control group. So P less than 0.001, so difference highly significant, showing demonstrating that the intervention we did was effective. Even after 9 months, because long-term effects of intervention are always little doubtful, we did again, and the difference was still, although there was quite a bit of relapse, as you see, the intervention group only had 18.5% who had reported stopping, but even then it was much higher than the control group. The P was 0.06, but if we took this subgroup only of teachers who attended the program, who followed the program, then it was significant. That is published in the paper, research paper. Next slide, please. Now, in delivering intervention, there were a lot of challenges. Schools really don't have any funds for tobacco control. Even for a very small activity, if we want, that they should use their funds, they don't have. We found that wall painting was very effective. Schools have outer walls, boundary walls. If they paint something about messages about tobacco control, and some scientific information about tobacco, that is very effective. But schools didn't have any kind of money to even do that. And previous slide, please. What we said, that there should be no tobacco use in the school premises. That was a part of our policy. But then many schools, rural schools especially, they don't have a gate or boundary wall. So outsiders can come in their premises and they can use tobacco and throw their pouches, etc., in the premises. And of course, school teachers are always very busy. I mean, in addition to teaching, they have lots of other responsibilities from the state government. All the programs, they are first put on teachers to implement. So everything that we ask teachers to do, we have to take great care that it fits in their schedule and they can do that. Next slide, please. Now, there was one challenge that many initially, since our focus was on tobacco cessation more, teachers who did not use tobacco thought that they are not part of this program. They don't have to really worry or be included in the program. So we made special efforts. We tweaked the messages, intervention messages, by requesting non-users to engage with those, engage in the program and engage with the others who were using tobacco. So ultimately, we found that then all teachers, whether users or non-users, did take interest and became a part of intervention program. We also found that school grounds were used on holidays for outside functions as marriages, gatherings, community. So tobacco control compliance outside school hours could be affected by such gatherings. It was affected. Next slide, please. Now, this was successful in our study in 72 schools. But then what about larger scheme of things, large number of schools? So the feasibility of upscaling this evidence-based intervention was assessed in an implementation and dissemination project. Now we know Bihar, all the states, they are divided into districts, and districts are divided into blocks. The schools in each blocks are divided into clusters. Each cluster has a cluster coordinator. The job of cluster coordinator is to train headmasters and government programs, changes in curriculum, and meet with them about at least once a month. Generally once a month, their meetings are scheduled. So next slide. So what we did to upscale the program in the implementation dissemination project, we selected 3 districts of Bihar, and we selected 2 blocks which were not close to each other, which were far away from each other. So we selected 2 blocks. Then we randomized 2 blocks, one into intervention block and one into control block. Then the intervention block, the cluster coordinators in the intervention block were trained in all the 6 themes of intervention. Cluster coordinators, have regular meetings with headmasters. So in their regular meetings, they were supposed to train headmasters, deliver the intervention messages to headmasters in their routine meetings. And of course, we, as a project monitoring, we are obtained feedback at every stage. Next slide, please. Now, this is just a photo of showing training of cluster coordinators in a block office in Bihar. You can see, perhaps recognize Dr. Mehta, Dr. Dhiren Sinha is teaching or training cluster coordinators. The great tobacco control advocate, and he was also a resource person for tobacco control in Zero WHO office, but he has been connected with this Bihar project since its inception. Next slide, please. Now, we did the feedback analysis and post-intervention surveys in the intervention blocks and also in control blocks. And these findings showed that the intervention was delivered by cluster coordinators as planned. Headmasters did implement the intervention in their schools. There was considerable spillover effect in intervention schools of conducting innovative additional tobacco control activities. And this was very important and very interesting, because we learned in our earlier RCT that they are doing something even more or different than what we are telling them to do in terms of tobacco intervention. They take tobacco intervention to the community also, and we didn't ask them to do anything with the school children, but on their own, they teach school children also, and they incorporate tobacco control lessons in their own teachings. So now the question was that this was also successful. The findings have been published, as you see, this one and other papers are there, where these, what I'm saying, are described in numbers and great detail. But now again, the question was that we did it, we finished the project recently in the 6 blocks and 3 districts, but what about rest of the schools in Bihar, or rest of the districts and blocks and schools? So what we did, next step was, whatever training we had given, training manual, training we had given, we converted it into a self-help manual for headmasters. And we printed that, we translated into Hindi and got it printed, and we gave it to the education department. Next slide, please. And this is the photo of front page of this self-help manual, Swayam Sahita Sandarsha. And we gave it to this, we met the education minister of Bihar, gave it to him, all the top officials of the education department in Bihar, and they promised cooperation in disseminating this particular manual. So we gave them a soft copy also. And the hard copy, we printed enough copies to give them to each block in Bihar. Next slide, please. So we first thought that we will give it to education department, and through their routine kind of distribution system, they will do it. But then we were told that better don't go that way, because you will not know what happened, whether they are, how many are lying in go downs, and how many have really gone, and how many have been destroyed and all that. So we took it upon ourselves. We knew that all block education officers come to the district headquarters and meet with the district education officer once a month or so. So we found out those dates, and one by one, our person went into district office and distributed these manuals, one to each block officer and to district education officer. And this we did with all the districts in Bihar. So a total of 541 manuals were distributed in 535 blocks across 38 districts. The government, we had given hard copies as well as soft copy. So soft copy of the manual was given to them and they distributed. Almost like 50,000 schools, this soft copy was distributed. And we did all the feedback studies also. They did get, but many were not able to download or read the manual. So we helped them. We helped in resending the manual, downloading, reading them. Now this was for Bihar, but the findings of the research were applicable to all states in India. So we wanted to disseminate in other states also. So next slide, please. So what we did was we are in Maharashtra. Healis is located in Navi, Mumbai, Maharashtra. We are here in Maharashtra. So we translated this manual into Marathi and we printed it. And the printed Marathi version was released in a press conference in Mumbai in collaboration with Education Department and relevant NGOs on January 24, 2024, so less than 6 months back. And then the printed copies have been offered and distributed. So, so not only this, next slide, please. What we have done for further dissemination, next slide, please. We have put all the material, including the all the manuals, all the posters, and posters have been put in high resolution because okay, you don't have the further slides. I think they are cut off.
Okay.
They might be cut off. No, it doesn't matter.
Okay.
So we have put the manuals, the quit in both languages, quit booklet in all languages, and posters in high resolution, because if somebody wants to reprint those posters, they require high resolution copy, not just ordinary PDF copies. So those have been put on our website, healis.org, and you can look at IEC material, and you can find everything over there. And anybody interested is welcome to download all those material and use that. And all this material is, as I said, is based on almost like 25 years of research. The findings have been published in like at least 28 research papers I could count, perhaps more, and more are coming. And these are just a few selected references. And if somebody wants to translate this manual into other languages, they can also do that. So this is a study which shows complete end to end, from locating, finding out the research question to complete providing intervention, solution, implementation, dissemination, not only in the one place, but all other places also. So this is a kind of saga of a case study of spanning almost a quarter century. And thank you all very much for your attention. You are all welcome to use the material that has been developed and put on the website for everybody to use. Thank you very much.
Thanks a lot, Dr. Prakash Gupta. So it was, especially I like the posters, the 6 posters you have provided to the teachers. They are excellent, actually. School teachers, as you told, that they are the role models, but tobacco prevalence was as high as 77% in the state government schools.
Yes, yeah.
That is quite high. And you were actually working in a very difficult state. So global school personal survey that was conducted between 2000 and 2003, and you chose about 50 central government schools. So, and very surprisingly, the prevalence was 0.11%. No, the knowledge about the ban in tobacco use in teachers in the central government school was 0.1%, and in the state government it was 67. 67.3 never knew about the ban.
Yeah.
You mean to say? So that is quite a lot. So thanks a lot for sharing your study results, and the forum is open for any questions. So Rajiv is with us. Yeah, Rajiv from
Just one more comment, Rakesh.
Sure.
Over the years, this was of course long back, that 77.8, and since then it is reducing. And in the gates too, one of the largest decrease in tobacco use has been in Bihar. I won't say it is because of our work, but it may
it is always cumulative.
Some role, but it is this is a satisfaction that Bihar has done so well in terms of reducing tobacco use.
This must have been one of the reasons, actually, but there may be other reasons also.
There would be other reasons, of course.
Yeah. So we have Dr. Ramprasad, Sanjay ji, Aruna, Dr. Aruna, Rajiv from our CTC, they are with us. So, Dr. Ramprasad has raised his hand.
Sure.
So let's listen from him. So what he wants.
Sir, a very good afternoon. A very good afternoon to all of you. Very good afternoon, Prakash sir. Very
good afternoon.
Thank you so much for your insights. Very valuable presentation. Sir, I just had one query in relation to this particular study and project. Sir, we sometimes see teachers using students to get tobacco. Because of the age-related issues, the teachers may be sending the boys or girls to fetch tobacco. Was that also seen in your study? Because sometimes in families, the father or the mother using tobacco is himself or herself not going to the shop to fetch tobacco, to buy the cigarette, to buy the bidis or gutka. So they're indirectly using their own children or siblings, young siblings, to go and fetch. Was this experience also seen among school teachers, sir? Any insights on that?
Yeah, we had suspected that, because as you say, and you observe all over, we also suspected that was perhaps happening. But once we started our project and gave messages, from further this thing, we found that it was completely stopped, because teachers, we asked teachers to take pride in not using tobacco and not using themselves, not telling others not to use. So I think that was completely stopped. We didn't find it afterwards. Any example of teacher sending student for buying tobacco?
Okay, sir. And in your experience in the Indian context, have we conducted any such study in relation to utilization of children or siblings for fetching of tobacco? So, do we have that data? How many such incidents, and what are the patterns? What are the trends in fetching tobacco? Any insights on that, sir?
I'm not sure of any data availability, but whenever we have tried to find out, it's very difficult. Everybody says, no, we never do that. How can we do that? So, it's through surveys, it will not be feasible to find out.
Right,
but
sir,
you can see that you can find out by looking at the minors who might still be buying tobacco from tobacco kiosks. And that is there. So, and whether they are buying for themselves or somebody else, we don't know, but that is still there.
Thank you, sir. Thank you so much.
Rajiv, can you ask all to open up the video so that we can have a snapshot before asking Dr. Aruna?
Okay. So, as mentioned, Dr. Rakesh. So, I request all the participants, please switch on your video for some time so that our team will take some screenshots. And thank you, Dr. Prakash Gupta, sir, for this wonderful intervention you shared with all the delegates, all the participants. So now over to Dr. Aruna Das, ma'am, for your comment on this.
You have taken the snapshots?
Yes, sir. It's in process.
Okay. So please keep your videos on. So in the second frame, we have very less people opening up their videos. Dr. Asha, Seema, Udain, Babita, Nandana, please.
Yeah, done, sir.
Okay, thank you. Thank you.
So over to Dr. Aruna Das, ma'am.
So Dr. Aruna, your question, please. You are muted,
Yeah.
I think. We can't listen to you.
You are not audible.
Or you can just read in the chat. Just write in the chat then. So Dr. Nishita.
Hello, sir. I'm not a doctor.
It doesn't matter. But all are doctors with us.
Okay, sir. Actually, sir, मेरा एक क्वेश्चन था.
हाँ जी.
जिस स्कूल में टीचर्स ही टबैको यूज करते हैं, वहाँ स्टूडेंट्स को कैसे अवेयर करें?
हाँ जी sir.
That's a very good question. In fact, that is exactly the reason why we thought of starting with children, about the school teachers. Because in the Global Youth Tobacco Survey that was done in Bihar, even the students, the prevalence of tobacco use among the students was also very high. So whether we thought that we should do something with the students, but then as you say, if teachers are using tobacco, what is the point in trying to teach students? So that is why we started with school teachers. And what we found was that when school teachers understand, they get some messages, they by themselves, without our asking, they started passing it down to children. In fact, working with school teachers was not an easy proposition, because as soon as you go into school, to go into education department, anything that we want to do this kind of study, conducting study, they always say, yes, students are there. You come into classroom, you go into their assembly and talk with them. And then we said, no, we don't want to talk with the students. We are not working with the students. We want to work with the school teachers. And they said, school teachers? Nobody ever works with the school teachers. Nobody has come to for any program with the school teachers. Why do you want? And say, that's what we want. Because if they are aware and they don't use tobacco, then the message will automatically filter not only to students, but in the community as well. And that's the reason we want to work only with the school teachers, not with the students. And that was quite a difficult thing, but we sort of stuck to it, that we will work only with, when we work with the school teachers, we will work only with the school teachers and let them work with the students and with community members. So that is very important, that we first sensitize and work with the school teachers before we start working with school children. Thank you for your question.
Thank you.
Thank you, Dr. Gupta, for answering the question. Dr. Aruna, can you speak now? We are not able to hear you. Sorry. So, no, we are not able to hear you. You can put your question in the chat box. Mr. Verma, do you have any comments on the presentation? Yes, sir.
To me, case study is always a very interesting presentation, because it presents the facts and figures. Then which at the end of the case study, we have a measurable output based on the transparent data. So moreover, when a case study is presented, it becomes very easy for the the participants to understand the the issue. So today's the presentation made by Dr. PC Gupta, as he always does, in a very simple way, but with all the concepts presented beautifully, so that anybody who's even a person like me, who is not a medicos, can understand the things. So nice, very nice presentation, Dr. Saab. I am very grateful.
So thank you, Vermaji. So do we have Mr. Sanjay Seth with us from the Sambandh Foundation? He actually wanted to join, but initially he couldn't join. Mr. Sanjay Seth, are you with us? I think we have lost contact with him. So anyone else who wants to ask any question, or there's any query or Any comment even?
Okay, I see the question by Dr. Aruna.
Aruna, yeah.
Contamination of intervention to control group. It's a very
Yeah.
interesting question. Methodologically very important.
Mhm.
And we had to take great care because to avoid that, we selected, for example, in our dissemination implementation, we selected the two blocks, intervention and control, as far apart in the district as feasible. But still, we cannot guarantee that there was no contamination, although the possibility was very little. But also, if there is contamination, what will happen is that will reduce the differences between intervention and control. So even after even if there is some contamination, but the differences are significant, then it doesn't really matter. Real differences would be more than what they mean. But if they are not significant, then the issue is whether it was due to contamination or was the intervention completely non-effective. So it's a very important methodological kind of question that we have to take care while designing this study. Thank you, Dr. Aruna, for your
Dr. Aruna,
interesting question.
we can't still hear you. If you have any comments upon the answer, you can just put in the chat box. Okay, she has just thanked. So thanks a lot. So anybody who has a query or a present or comment even, they can just ask. So Dr. Gupta, actually we had more than 50 people, and this is a purely academic session, I think.
Yes.
It was actually Dr. Aruna benefited the most, I think, because she is an academician. Yeah, and Dr. Ram Prasad too.
Dr. Aruna is so enthusiastic and participatory. I see her practically every webinar that is there that I also attend, and the same way with Dr. Ram Prasad.
Yeah,
He's so enthusiastic.
They are both with us.
Always there in everything.
Actually, Sipher is indebted to them for joining each time.
Yeah.
Thank you, sir. Great learning, new thoughts and learning from every session. So thank you so much. Very grateful to both of you. Thank you so much.
Thank you, Rajiv. So Rajiv, I think if there are no more comments, then we can wind up the session.
Actually, I want to ask one question.
Yeah, sure.
Nishita's questions. So, PC sir, these days, students using new emerging products. I have seen few of the schools visit, and they we found that new emerging product, they are aware about it, despite that these products are banned in India. So teacher also not fully aware about these interventions. So so now these days, either we need to add some curriculum in the study material also regarding this harmful effects of tobacco, because there's no syllabus, there no such activity. So how to handle these situations, sir, according to you?
Yeah, that's a very vexing question and very correct question, because although the products are banned, to school children, they are still available, surprisingly.
Yes.
And all our studies show, in the GETS data, as well as our own study that we published comparatively recently, showed that there is more awareness of e-cigarette among adolescents and children than among adults, and more use also.
Yeah.
So the entire marketing and advertising of these newer products and e-cigarettes is reaching children much more than it is reaching adults. So they are really the kind of primary target, and they are completely banned in India. So it is one is a question of enforcement, and second point, as you very rightly say, awareness also, because even teachers and parents are not aware, and there are so many case studies and stories that come out that even if they see something in children bag, school bag, children say, okay, this is electronic, this or their pen or something, and they don't bother. They don't know what it is. So some awareness, even though it is banned, awareness among teachers and among parents about these products and their harmful effects, and the fact that these are banned products, that is definitely, I think, required, so that the industry, which is very insidiously marketing these products, and that kind of marketing and sale should be curtailed and stopped. So some awareness is absolutely necessary about this, especially among adults.
Yeah. So thank you, Rajiv, for asking this question. So I think it is important. I've been invited tomorrow by the education department. So they are going to air that program, that presentation all over Punjab through EduSet satellite connection.
Yes.
So I think that is very useful, and some of the points and some of the posters I'll be sharing with them from today's presentation. So thanks a lot, Dr. PC Gupta. Thank you.
Sure, sure.
Thank you, sir. Thank you.
So I'm doing it without your permission.
No, go ahead. No, go ahead. I'm happy. If you tell me that they are being used, that's wonderful.
I'll ask them to
Their
translate
knowledge.
them into Punjabi if possible.
Sure, sure.
Yeah.
And as I said, you have, if you want to do that, there is a high resolution copy available, which printable copy available on the
Okay, in that case, I think you must send me the PDF.
I
of
do not
those 6
PDF.
posters.
PDF is not very good for printing. You can take down that high resolution copy that is there on our website, download that.
Achha,
and
it
then
is on your
give it to
website.
print.
Okay,
It's on
okay.
our
Thank you.
website.
Okay. I'll take that down.
Sure.
Okay.
Welcome.
So Rajiv, if there are no more questions, then we can just propose a vote of thanks, a formal vote of thanks.
Sure, sir. So thank you, everyone. Thank you, sir, for giving me opportunity to propose vote of thanks. I hope I'm audible to everyone.
Yeah, yeah.
On behalf of Sipher, RCTC, and PGI, and Eco India, I extend my heartfelt gratitude to each and every one present here today. And special thanks to our keynote speaker of the day, Dr. Prakash C. Gupta, sir. I'm sure we all agree that it was a great learning experience from the insights of Dr. Rakesh Gupta sir's presentation. So a great experience and a great presentation intervention at Bihar involving school teachers in tobacco controls. So thank you, sir. And dear friends and professionals, we know that these type of events required a planning process. So I want to thanks and congratulate the organizing team led by Dr. Rakesh Gupta sir, Mr. Arun Verma sir from Sipher, and team of Eco India, who did not leave any stone untouched in the success of this session, and their tireless effort has been instrumental in ensuring the success of this particular webinar.
Rajiv, I think you must name Nardeep also, because he is producing all those creatives.
Yes, so Nadeep from Sipher team. So thanks to Nadeep also. Lastly, I wish to express my gratitude to all the participants who registered for this particular webinar series, and trust this information is very informative for everyone. And I hope you can replicate these learning in your particular areas when you are going to implement your interventions. So thanks to everyone. Thank you. Have a nice day.
Thank you.
Thank you.
Thank you.
Thank you,
all.
everybody.
Thank you.
Thank you, everybody.